What are MDS risk factors?
So MDS risk factors, they're similar to AML, many of them, um, just aging. And that's hard because you want to get older. You don't want to die early. But just getting older, we have like mutations that some of them we were born with. There's germline mutations that we're starting to understand. But the majority of times, it's something that's, that occurs over time as our cells are going through their process, that just aging alone is a risk factor. But also, like, things in our environment. We know that pesticides, some of the pesticides, benzenes, things that can be that you're exposed to over time.
How do I become more knowledgeable about MDS?
Studies have shown that educated and empowered patients often have better outcomes. HealthTree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit HealthTree University and become an empowered patient today.
I can think of one of my patients that was so healthy, but he had his own business for like 30, 40 years, spraying for pesticides. And he had all of those classic cytogenetic abnormalities that went along with getting, like, he had chemotherapy or radiation therapy, which are also risk factors. And when a patient develops myelodysplastic syndrome or AML from their treatment from a prior cancer, we call that secondary. So having radiation or chemotherapy in the past is also one of those risk factors. And we're hoping to figure out, like, who is born with these germline mutations that might make them more prone to developing MDS or AML when they start treatment for a solid tumor. Because sometimes, like in breast cancer, for example, if they have like a stage 2 or limited stage breast cancer, you give them some additional treatment like a radiation chemotherapy to reduce the risk of getting metastatic disease, and giving that reduces it by 2%. But if they had one of these germline mutations, you might increase their risk of developing MDS or AML by 5%. So it's kind of, I think, understanding if they have one of these mutations at birth, whether that will predispose them, whether they should get chemo or radiation.